eve of the day in which we celebrate our heritage, our culture, and all things Bermudian, and a day when many of us would normally be locking in our parade spot and setting up our camps. We recognize that this will be a Bermuda Day unlike any other in our recent memory. Many will experience a virtual Bermuda Day parade in place of our usual floats, majorette bands, and gumbays. Some will be boating without rafting up, and family gatherings that will be smaller and require physical distancing. All things very alien to us as Bermudians, but very necessary. The announcement of more confirmed cases of the coronavirus over the past few days is a reminder that this virus is still a very real threat. With the reopening of the economy and our aggressive testing regime, we expected that more cases would be identified. And while no news of any new cases of the coronavirus could be considered good news, the early identification of these cases means that as a community, we are better placed to contain the transmission of this virus. Our real time reproductive number remains below one, and we remain among the world leaders in testing per capita. I expect to receive a presentation on the revised bottling numbers within the next week. As we did previously, we will share the details with the opposition, members of parliament, the Senate, and other stakeholders, and we will provide an update to the public at a future press conference. We currently have the supplies on island to test 12,000 people in Bermuda, which is about a 2-month supply at our current test rate. Additionally, we have enough testing kits to conduct a further 180,000 tests. We have the PPE to cover the needs of all of our essential workers, and the hospital has enough beds to avoid being overwhelmed at our current rates of transmission. However, the numbers announced over the past few days means we must remain alert and continue to follow the physical distancing guidelines. These guidelines apply to the young people in Bermuda who are socializing without masks. I cannot stress enough the importance of wearing a mask. There are some in our community who do not have symptoms of the coronavirus, yet have this virus and can spread it to others, meaning that you can spread it to others and then infect vulnerable family members. That is why wearing a mask is crucial. You are protecting those around you and you are helping to prevent the spread of the virus. The island is currently in phase 2, expansion of services. As a government and as a people, we do not want to go back. We want to continue progressing with the opening of our island, ensuring that more of our fellow Bermudians can get back to work to safely provide for their families. The Ministry of Health is continuing to monitor this pandemic closely and has developed a set of indicators so that we can judge how well our country is doing in all the metrics required to keep this virus at bay. Furthermore, the resources and support of the government, the opposition, public officers, the private sector, our union partners, and other stakeholders are all tasked with working together to ensure employees can get back to work safely at the appropriate time while preserving the health and well-being of everyone on our island. The trust that you have given us, the support you have provided us, and the responsibilities you have placed with us are things that we consider sacred, and we will continue to make decisions that will keep each of us safe as we move forward with the reopening of our economy and getting people back to work. At today's press conference, I'm joined by the Minister of Health, the Minister of National Security, the Minister of Public Works, and the Minister of Finance, who will give various updates on respective issues within their remit. First, we will hear from the Minister of Health, who will update on the latest cases, speak about the importance of shielding our vulnerable in light of the seniors who were recently hospitalized with COVID-19 and the regulations in place for retail establishments. Minister of Health.
Good afternoon. Today, 115 test results were received by the Ministry of Health, and one was positive for COVID-19. Bermuda has 140 total confirmed positive cases, and their status is as follows. There are 39 active cases, of which 30 persons are under active public health monitoring, and 9 persons are hospitalized, of which 2 are in critical care. A total of 92 have now fully recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 61, and the age range of all of our positive cases is from 18 to 101 years. The average age of persons hospitalized is 76, and their age ranges from 66 to 91 years. The average age of all deceased cases is 74, and the age range is between 57 and 91 years. The source of all local cases is as follows: 41 are imported, 83 are local transmission with known contact, 10 are local transmission with an unknown contact, and 6 are under investigation. Bermuda's country status remains at local transmission with clusters of cases, and our real-time reproduction number is 0.83. While our transmission rate is very good right now, I want to remind the public that shielding seniors and persons who are clinically vulnerable remains extremely important. Some of the recent new cases that we have seen were due to insufficient shielding, indicating that everyone may not fully understand the principles of shielding. An individual who is more susceptible to COVID-19 complications must be shielded, not just from the public, but also from household members who go out into the public. For instance, a family member who is a caregiver of a vulnerable person must take strict precautions when providing hands-on care to that shielded person if they themselves are going out and about and doing shopping, running errands, and even casually socializing with others outside of the household. Shielding means protecting the medically vulnerable persons from anyone who has outside of the home contact with others. So if you are taking care of someone who is shielded or simply wishing to visit or help them, remember that you are at risk. So take care and wear your mask, as well as to stay 6 feet apart when possible. And if you must do hands-on care, review the guidance for caregivers outlining the precautions that you must take. I'm extremely pleased to see that the Health IQ app is being used by more and more people. Adoption of new technologies is going to play a vital role in our phases of reopening, so I encourage everyone with a mobile device to download Health IQ and update your status regularly. The heat map that's provided by the Health IQ will give you a good sense of geographical areas in Bermuda where there may be higher concentrations of cases, indicating that you must wear your mask and practice distancing and hand hygiene more vigorously. These actions will feed into our reopening indicators, so it is extremely important that as many people as possible give their information and their status to the app and download the app. And you can do so by visiting healthiq.bm and then download the app. As we enter a holiday weekend, I want to remind the public that preventative measures helped get us to where we are now in phase 2, and without them, we will not be progressing to phase 3. Restaurants have been asked to collect names and contact details of their patrons, and I understand some have faced resistance from members of the public. However, we do need everyone to cooperate because this is vital information that we require at the Ministry of Health to assist us with our contact tracing efforts. Patrons' contact information is being requested so that contact tracing can take place rapidly if a positive COVID-19 case is identified at that restaurant. Without the contact details, our contact tracing team would be unable to reach other persons who may have been exposed as they were dining at the same restaurant at the same time at a nearby table. So this information is extremely important. And when the restaurants ask for your contact details, please oblige them because it will assist us at the ministry to deal appropriately with the contact tracing. We are also amending the guidance so that only one person from each table needs to give their contact details. This will suffice for contact traces in the event of an outbreak and should reduce the amount of information that needs to be collected. As of May 21st, retail stores which had previously operated under curbside and delivery only service were able to open their doors to in-store customers. but only under certain conditions. These conditions are detailed in the Phase 2 retail directives that are published on the government website at coronavirus.gov.bm, and some of which I will share with you now. For in-store shopping, staff and customers must wear masks at all times, and physical distancing of at least 6 feet must be maintained during any time in which you are at queue or in the checkout. Additionally, customers must use hand sanitizer provided before entering the store. The regulations have also been amended so retail customers will be able to visit any day, not just by the allotted shopping days of their surname. And the same will apply to pet stores and gas stations. The shopping days organized by alphabetical surname will remain only for grocery stores, and that, as a reminder, is as follows. A through F are Mondays and Thursdays, G through Q, Tuesdays and Fridays, and R through Z, Wednesday and Saturdays. Sundays will be for seniors and shielded persons up to 1 o'clock p.m. And from 1 o'clock p.m., the amended regulations will allow persons over 55 years of age and essential workers to shop. Seniors and essential workers may shop any day of the week. As a customer, you should notice many physical changes in the retail stores that you visit, such as floor markings and barriers, as well as increased signage reminding you to follow the physical distancing requirements, hand hygiene, and the need to wear a mask. Accordingly, there should be accessible and visible sanitizing products for customers and staff, with hand sanitizers placed at each entrance of the store. Only one person will be allowed to use the restroom facilities at any given time, and all surfaces must be regularly sanitized. Where possible, stores should continue to provide online ordering, delivery, or curbside pickup to reduce the need for customers to enter the store. Businesses are required to monitor the health of their staff. Managers should look out for any staff members showing symptoms of COVID-19, and any employees showing symptoms should not be allowed to go to work. And managers will also have the right to refuse entry of customers who show any signs of illness, such as coughing or sweating, and this is at the discretion of the managers. We encourage all frontline workers in personal care services and retail to get tested. The drive-thru at Southside currently has openings for Saturday and Sunday, so we encourage you to register online now. I should highlight at this point that the website has been revamped to ensure the vast amounts of information being published daily can be found more easily. If you haven't been on the site recently, I invite you to do so and go to coronavirus.gov.bm and browse the guidance documents, such as the one for restaurants and retail, as well as other very important and useful information. Before I close today, I want to remind people about the Argus Telenurse Hotline and the GP Telehealth Consultation Services, which is a vital resource for those persons in our community that are uninsured or HIP clients. When an individual calls the COVID-19 hotline and they are feeling unwell with symptoms that are unrelated to COVID-19, they are then, and as well as if they are uninsured or have the government's HIP health insurance policy, they will be transferred to Argus's contracted telenurse vendor, which is PhoneMed. The telenurse will provide advice, and if the individual needs to consult with a GP, the calls will then be transferred to Argus to set up a telehealth consultation with a GP here in Bermuda. And the COVID hotline number again is 444-2498. Telenurse advice will improve access to healthcare and minimize unnecessary use of hospital emergency rooms and other medical services. Finally, I'd like to reiterate the message of caution during the holiday weekend. Please remember that we are in phase 2, which is an amber light, to proceed with caution. This is not a green light to party, even during a holiday weekend. Most people are truly fantastic in making an effort and following the rules, but it only needs a few careless people to cause an outbreak. If you see any infractions or groups over 10 congregating, not maintaining physical distancing, etc., please call 211 to report it. I know persons like to take pictures and or send them to their MP, but the surest way to get an infraction acted upon is to report it to the authorities by dialing 211. In closing, I would like to wish everyone an enjoyable but safe Bermuda holiday. Wear your mask at all times, practice physical distancing, Wash your hands regularly and keep your social bubbles limited. The better we behave now and follow the rules, the greater the likelihood of a more normal summer ahead. Thank you.
Thank you, Minister of Health. And congratulations to the team that works in the Department of Communications to put up on the new website, coronavirus.gov.dm, which is easier to follow, and you can find the great amount of information is much easier to access now. I just want to reiterate what the Minister of Health had said on the importance of shielding. If you are a family member of someone who is in a vulnerable population and you decide to put them at risk by hanging out with persons who are not wearing masks, then that means that you are putting them at risk. As has been stated, there has been recent hospitalizations of vulnerable persons, and that has come from the fact that family members, even though these persons are staying at home, that family members are bringing this virus into their homes. And I cannot stress enough that if you are out in public with people who are not wearing the mask, you are putting your family members at risk. Maintain your physical distance and be smart, because if you are outside with others, that is the same as your vulnerable family member being outside. And we've seen some of these new cases, and I cannot stress it enough that if we are not individually responsible, then we will see more vulnerable persons who are staying at home and following the rules become exposed due to persons that are bringing the disease, family members that are bringing the disease into their household. The Minister of Public Works, Lieutenant Colonel David Birch, has been tasked with chairing the Cabinet Committee on the reopening of our economy. Today, he'll provide an update on the decisions reached and changes to the regulations that went into effect today, and some additional restrictions for our public parks and beaches this holiday weekend to ensure that Bermuda remains safe. Minister?
Thank you, Premier. Good evening. In early April, the Premier appointed a cabinet subcommittee of the frontline ministers in this pandemic, they being the Ministers of Health, Education, National Security, and Tourism and Transport, and myself, to collaborate, coordinate, and make recommendations to the full cabinet on reopening the economy. The aim is for the committee to review progress on the various phases, receive external submissions, assess them, and make recommendations to cabinet on the way forward. The purpose of the phases is so that planning can occur and the timing of each phase can either be accelerated or slowed depending on the public's behavior. To that end, I can advise the following changes published today. The requirement to mandatorily quarantine will cease on Sunday, except the approximately 20 remaining persons who will complete their time there at the dedicated facility. Anyone arriving in Bermuda after the 31st of May will be allowed to self-quarantine at home for 14 days, as was the case before a government quarantine facility was provided, subject to the following conditions: regular police checks and regular healthcare visits. 2, the alphabetical requirements for shopping days will be removed for retail, gas stations, and hardware stores, but will remain in place for supermarkets. Sunday shopping will be restricted to seniors and vulnerable persons up to 1 p.m. and then open to essential workers thereafter. One of the things we have noted already in phase 2, particularly in the restaurant sector, is the non-compliance to the social distancing rules, while at the same time receiving appeals from the Chamber of Commerce to relax the regulations further. Might I suggest that the Chamber's responsibility also extends to encouraging their members to adhere to the regulations as well. The alternative is them being shut down. Looking forward, the committee is constantly reviewing progress through this phase 2. With a view to how we might accelerate this phase, as well, we expect recommendations from the Minister of Education on the opening of schools, and the discussions on the very complicated opening of our borders continue with the Minister of Tourism and Transport. Top of the list at this stage is the approach to summer camps from the Department of Youth, Sport, and Recreation, and I expect that next week we will have a decision made in that regard. Additionally, broad consultation with the players in phases 3 and 4 will occur before we get to those stages so that the necessary preparations can occur. Finally, under the authority of Section 25G of the Bermuda National Parks Act 1986 and Section 3 of those regulations 1988, the minister responsible for parks has the authority to make regulations, the following of which will come into effect for Bermuda Day holiday on the 29th of May, Saturday the 30th, and Sunday the 31st. All beaches and parks and nature reserves will be closed from 8 p.m. until 6 a.m. the following morning. There will be no camping permits issued, and overnight camping at designated campgrounds, parks, beaches, or nature reserves is not permitted. There will be no bonfires allowed at the parks and beaches, and no special bonfire permits will be issued. This is not punishment, it is protection. In the main, the majority of residents have followed the public health protocols, and we must continue to do so. In the forefront of our minds is the mitigation of risk with directives from health and how we manage this crisis. That is what drives our decisions. Thank you, Premier.
Thank you, Minister Birch. News of businesses having Bermudian workers stay home while employees on work permits were brought back in is deeply disturbing to us as a government that is committed to putting Bermudians first and is unacceptable. We condemn these actions and encourage anyone who knows or who has evidence of these activities or any other violation of our immigration laws or work permit policies to report it. Those who choose to break our laws, skirt our work permit policies, and act against the best interests of the country and against the spirit and unity and togetherness displayed on our island will be dealt with under the law. Today, the Minister of National Security will provide an update on matters related to immigration and matters related to enforcement. Minister?
Thank you, Premier. Good evening, Bermuda. As we approach the holiday weekend, the Royal Bermuda Regiment will triple their force on land and sea over the long weekend, establishing visibility in public places and strong enforcement of the evening curfew. Although the community has been generally compliant with the laws and regulations thus far, there is an expectation that the use of boats, beaches, and parks will increase during this period. The Coast Guard will continue its 24-hour-a-day coverage, taking particular interest in boat movements in the early morning where raft-ups are common. Coast Guard jet skis will be out each day to monitor public behavior on the water, and the BPS is expected to utilize for the first time drone capabilities in the Great Sound. Boat operators and passengers are reminded that they are to be off the water by 7 p.m. Any vessel found to be used for recreational purposes after 7 p.m. will be considered in breach of the law, even if they are returning to their dock or mooring. As a reminder, here are some other holiday weekend guidelines that the public should be aware of. Boats and watercrafts. All vessels must be off the water by 7 p.m. Only 10 people maximum per boat, including crew, should be on the water or in a boat at one time, and they all should be exercising physical distancing in and out of the water. There should be no raft-ups. All patrons must be off the beaches and parks at 7 p.m. This will be enforceable by 8 p.m. There should be no overnight camping. The public should still be exercising physical distancing on the water and on land. The Bermuda Regiment and the Bermuda Police Service will be patrolling the beaches and parks to ensure compliance, even whilst people are swimming in the water. Restaurants, remember, outdoor dining only. Guests must provide their personal details to the restaurant staff. Guests must be masked until seated. The public can report any breaches by calling 211. I'd like to turn to immigration. The Ministry of National Security has been flooded with questions surrounding immigration. Here's what I can advise. On Monday, June 1st, the Department of Immigration will receive all types of applications for processing. This includes work permits, passports, land licenses, Bermuda status, naturalization, PRCs. All applications and submissions will be made via the drop box on the ground floor of the Government Administration Building. All incomplete applications will be returned by regular mail. Applicants are encouraged to ensure that their applications are complete at the initial submission. If they have doubts, they should contact the Chief Immigration Officer, Dr. Danette Ming, on dwming@gov.bm. Completed passports will be mailed via registered mail, and visitors' extensions will continue to be processed at the L.F. Wade International Airport. The department will maintain its online banking payment process. New applications will be accepted starting June 1st. This includes applications for Bermuda status, permanent residency certificates, extension of spouses' employment rights, permissions to let, land licenses, residential certificates, spousal letters, naturalization, British nationality, deferral certificates, and requests for copies of documents. The process is simple. Send a complete application including supporting documents. All of the documents should be sent again to the government, should be submitted in the drop box on the ground floor at the Government Administration Building. Passport applications. Expired passports will be accepted starting Monday, June 1st, 2020. There will be no requirement for counter-signatories for persons 16 years and older. The passport process is as follows. Send a complete application, including documents. They must be put in the drop box on the ground floor of the Government Administration Building. Your application will be vetted for completeness. Applicants will be contacted and advised that when their application will be processed or information that remains outstanding. If no additional information is needed, applicants will be instructed to pay the online fee and submit the application via the drop box. If additional information is required, the applicant must satisfy this before resubmitting the application via the drop box. New passports, first-time applicants, will be accepted Monday, June 1st. Counter-signatories are still needed for new passport applications. The process, again, is via the drop box on the ground floor of the Government Administration Building. Your application will be vetted for completeness. Applicants will be contacted and advised of when their application can be processed if all the information is correct. And if it is not correct, they will be advised of the outstanding information. If no additional information is needed, applicants will be instructed to pay the fee online and submit their application via an appointment. If additional information is required, the applicant must satisfy this before resubmitting the application via the drop box on the ground floor. And requirements for face-to-face interactions will be by appointment only. Turning to the area of work permits. For work permits that will expire between June 1st, 2020 and September 1st, 2020, the work permit holders can continue to work without penalty or the need to appeal to the minister responsible for immigration. Lastly, while the government recognizes the significance and sensitivities associated with the topic of immigration, as a country, we are facing times of the likes we have never seen before. The COVID-19 pandemic has resulted in business and economic uncertainty and widespread unemployment globally. Consequently, here at home, we are progressing forward. We will need to review, reassess, and reevaluate our immigration policies, procedures in order to adapt to these unprecedented times. More specifically, We will now closely be scrutinizing our work permit policy, as there are a significant amount of Bermudians who are unemployed. We must now look at closing certain categories. Quite frankly, permission to reside and seek employment is going to be assessed on a case-by-case basis. Employers and guest workers must understand that in this current climate, work permit approvals are not guaranteed. In instances where there are clearly opportunities for hiring Bermudians, work permits will be denied. As a result, in some of the cases, guest workers may need to leave the island if their work permit is not granted. We will make every attempt to balance the need for work permit holders who provide specialized services to remain in those roles. However, in these cases, local businesses must provide a training, development, and succession planning for Bermudians to take over those roles. Bermudians, we also have to take on responsibility. We must retrain where necessary, and we must be willing to work in areas of industry that we may not be used to. Ultimately, this government has a responsibility to ensure Bermudians have access to employment opportunities in their homeland. We've heard the heartache of people who have been left without work due to COVID-19. We've heard the devastating accounts of Bermudian families who during these economic times are desperately trying to make ends meet, who are desperately trying to pay their mortgages, their rent, and who have desperately been trying to put food on the table for their children. These are real accounts from real people who we know, our brothers, our sisters, our close family members, our neighbors, and our friends. So this government is urging our business partners as they reopen to consider hiring out-of-work Bermudians to provide a service in their establishment. If the Bermudian can do the job instead of the guest worker, then the Bermudian worker should take precedence. During this time of uncertainty, we must all do our part to help and support one another. And our businesses have a significant role to play ensuring that Bermudians are employed. Finally, the public is reminded that they can report any violation on the tip line at 296-5202. Thank you, Premier.
Thank you, Minister. As Premier, I am confident that the Cabinet Committee, under the leadership of Colonel Birch, and comprising of the Ministers of Health, National Security, Tourism, Transport, and Education, I'm confident in their ability to contain the impact of COVID-19 on the health of our community while safely reopening our economy so that persons can get back to work and to provide for their families. I have now turned my attention to working closely with the Minister of Finance to stimulate and reimagine our economy. The Minister of Finance will now provide an update on matters related to the economy and others in the Ministry of Finance. Minister?
Thank you, Premier. Good evening. I'm pleased to provide an update on three specific areas: the unemployment benefits, the Economic Advisory Committee, and the National Pension Scheme. This week, I authorized unemployment benefit payments to 7,780 people for a total of $9.2 million. We will now have paid benefits to over 9,000 people at a total cost of approximately $32 million. We expect further payments to continue on a bi-weekly schedule, which means another payment in 2 weeks on Friday, June 12th. As mentioned earlier, we continue to make progress to resolve problem applications, and this week we paid 640 applicants for the first time. Last week, I advised that over 1,400 people had notified the Department of Workforce Development of their planned return to work. This number continues to grow as Bermuda enters its second week of Phase 2, and over 2,600 individuals who were previously receiving benefits have now returned to work, up by more than 1,200 from last week. I want to reiterate that all individuals and companies have a responsibility to notify the government of your return to work to confirm your eligibility period. Please visit www.bermudajobboard.bm, follow the link at the top of the COVID-19 unemployment application, then the link at the top for the Back to Work form. For those that have already done so, we thank you for the act of responsible citizenship. The Economic Advisory Committee held its second meeting yesterday, and the committee provided initial feedback and comments on the impact of COVID-19 on all sectors of the economy. The committee explored proposed ideas that we have received to date from some of these sectors. In addition, the committee has now received submissions from other entities and individuals, including submissions made on the Government Forum website, and has agreed to include these as part of our assessments. The committee will now be reviewing other possible quick win ideas which could benefit the community in the short term. The public would be aware that the government recently amended the National Pension Scheme Occupational Pensions Act of 1998 to permit eligible members of private occupational pension plans and local retirement products as appropriate, A, to make a voluntary withdrawal of up to $12,000, and B, to withdraw up to 25% of their pension account balances. I am pleased to advise that starting on Monday, June 1st, persons will be able to make applications for their funds. With respect to the $12,000 withdrawal, applicants must be under the normal retirement age of 65 and not already retired. This is a one-time withdrawal, and applications are to be made to the applicant's private pension plan administrators. There are no fees associated with making this application, and applicants should contact their administrators via phone or by email. This option has been put into place as part of the COVID-19 Economic Relief Program to assist persons negatively affected by this pandemic. Therefore, persons will have until the 30th of June, 2021 to make an application to request a withdrawal. The Pension Commission has already provided guidance to plan administrators to assist them with reviewing, processing, and approving applications in order to make the process as efficient as possible. With respect to the 25% withdrawal option, persons eligible must be 65 years of age, retired, no longer working, and have not converted their pension account balance into an annuity. Applications are to be made to the Pension Commission. The Commission stands ready to assist retirees in answering any questions they may have, and applicants can contact them at 295-8672 for further information. There are no fees associated with making the application, and there is no time limit for retirees to make an application under this option. Thank you, and I wish everyone a happy Bermuda Day. Please stay safe.
Thank you, Minister of Finance, for that update. Before I move to some questions from members of the public and my close, I just want to add a note that this afternoon the government received confirmation that there will be a charter flight on Air Canada to Bermuda on the 5th of June from Toronto. If you are in Canada and ordinarily resident in Bermuda and you wish to return home, or if you are a Canadian resident and want to return to Canada, you should email info@traveledge.bn. There were a couple of questions which came in on my social media where I put out a request if persons had questions to answer. A number of ministers have already answered many of the questions of which were asked, but I do want to touch on two particular questions before I close. One question was, are we allowed to attach our moorings and sleep out and stay at our moorings, or do we still have to return home by 7 p.m.? The answer to that is yes, you must be off the water, as the Minister of National Security said, by 7 p.m. Another question which was asked, and this is an important one, it says, what is the goal when it comes to COVID-19? Is there a certain number of COVID cases we are trying to reach, taking into account that the cure could be worse than the virus when it comes to economic depression, social, physical, sexual, and mental abuse, or lack of other medical treatments? I thank that member of the public for their question. The Chief Medical Officer is here today. The Chief Medical Officer forms the advisory council with the Minister of Health and others, and this was a matter of which we discussed earlier today. The truth is that the government of Bermuda's policy is not the complete and total elimination of the virus from our shores. Though that would be great, it would require unprecedented economic damage and unprecedented isolation for that to be the case. And it would require our borders to remain closed until there is a vaccine and for all persons in Bermuda or enough persons in Bermuda to be vaccinated. That is not the policy of the government of Bermuda. The policy of the government of Bermuda is to aggressively test, trace, and isolate cases and make sure that we enforce physical distancing and the requirements to minimize the transmission of the virus in our shores. As the Minister of Health had indicated during her particular remarks, next week we will be unveiling a dashboard which will be able to be updated and will show the public in a very simple green, yellow, and red as where we stand on the various indicators which are necessary and responsible to either move us to future phases or require us to go back to previous phases. And that is the policy of the government of Bermuda. So we are trying to balance it, but we are not trying to move forward in a spirit of keeping our economy closed in an attempt to completely eliminate the virus from our shores. Because as you are correct, there are lots of other repercussions. And in some cases, the cure could be worse than the disease. In closing, we are facing a future that will require creativity, adaptability, and delivery by the government and by each and every one of us. We all have an important role to play, and we must each step up, step forward as we collectively raise our game as a country. Whatever we are doing, wherever we are working, we must show up and give that 100%, delivering a full day's work to make sure that our economy can become stronger. Our island's future depends on it. On the eve of Bermuda Day, we must embrace the values, strength, and resilience of our people. Those values of strength and resilience that we have displayed throughout our history. Over the centuries, we rebuilt our economy again and again, and over the centuries, we have reinvented ourselves. We had to be innovative and offer the world things of value and appeal. Our island of farmers and fishermen grew to become sloop builders, whale hunters, pearl divers, and then changed to become leaders in tourism and international business. As a country, we did not come this far by saying, "That's not my job," or being unwilling to do what it takes to succeed and make our island home better. As we continue to move through this pandemic, we recognize every country around the world is facing similar issues. How to rebuild their economy and get their people back to work. We have a lot of advantages here in Bermuda, given the fact that we are small and we are nimble, and we have the skills and the ability to do things differently. It's very important that each of us do what we can, where we can contribute to our country in a positive and productive manner. It is important that as we pause this weekend to celebrate our heritage, it is very important also that we look towards the future. And remember that the only persons who can shape the stories of which they'll be telling in future heritage days are those of us right now who are living through this particular pandemic. Before I take questions, I wish to wish everyone a happy and safe Bermuda Day tomorrow. With that, pleased to take questions from members of the media.
Good evening, Don Burgess, Bermuda Broadcasting. Mr. Premier, you just mentioned the Air Canada flight, and on the Air Canada website, they're offering weekly flights to Bermuda starting on Thursday, June 11th, and every Thursday after that. Has Air Canada been approved to fly to Bermuda?
No airline has been regularly scheduled commercial traffic, of which that would be has not been confirmed. So the simple answer to your question is no. There are other airlines who are also selling tickets. I mean, airlines are in the business to sell tickets. The Minister of Tourism and Transport is on the committee, which is led by Colonel Birch, and I think Colonel Birch has stated the approaches of which they're taking to moving towards regularly scheduled commercial traffic. Don't know if you want to add anything, Colonel. Okay.
Thank you. Health Minister or the CMO, spike of new positives, 15 over the last 7 days. Do you find that this spike in cases is a lifting to some of the restrictions in recent weeks?
Dr. Peekwell, do you want to? Get her a chair.
Thanks.
You're kidding.
You said recent weeks, and I would say if we're talking about 3 to 4 weeks ago, yes, that would be reflective of the spike, but the spike would not be because of the past week of being in phase 2. As you know, it takes 2 to 4 weeks, at least 1 or 2 incubation periods for the virus to really give its impact to the community. And so what we're seeing now is the result of what happened 2 to 4 weeks ago.
All right, thank you. Health Minister, you just pointed out that people should input their health status via the Health IQ way the public knows where the risks are in Bermuda. But the government already knows where all the positive cases are located right now. Why doesn't the government update the Health IQ with the positive cases in addition to the members of the public so that we know?
Okay, that's a good question, Don. The Health IQ app, which is, if you've had an opportunity to download it, it's really, really interesting because it will locate where you are and where there are cases of COVID within the area of, you can go to a particular, like Sands, for example, and I can see where there are cases and pockets of persons that have indicated what their symptoms are. So what you do is, have you downloaded it yet?
Yes.
Okay, so you can see. Unfortunately, Hamilton Parish, for example, seems to have a lot of persons that are located throughout Hamilton Parish that have either entered into the Health IQ what their symptoms are. So the benefit of this particular app is twofold. One, it allows persons to just have a real-time snapshot, so to speak, of where there are cases, or where not cases, I'm sorry, but where there are persons that may have entered in symptoms or feeling unwell and so forth within that geographical location. And B, this information will also assist us as we move to different phases because it's a lead measure. So when we have information about how many people are wearing masks, how many people are complying with all the other mitigants, this is a computerized use of technology to be able to use as a lead measure to help the government determine what's next, is whether we move forward or not.
But for the public's benefit of knowing exactly where the cases have been, don't you think that it would help us to know that we can see, like, for example, of the 139 cases, maybe let's say 40 were in Hamilton Parish, to have that on as part of the app?
I take your point. I'm not so sure that would probably work in the way that you think. And so far, I think that's kind of a simplistic view, because many of the cases, as we've said, are local transmission. That transmission could have taken place at a place of employment where someone lives in Hamilton Parish, but they're employed in town, for example. So I'm not sure it would gather the information that you are suggesting.
Okay, thank you.
Mm-hmm.
Some countries around the world have done a better job of tackling the virus than Bermuda. Some have had infections 10 times greater than Bermuda and have brought their infections to zero, close to zero. Of course, there are other countries that have done much worse than we have. Why do you think our recovery rate is so much slower here than in more successful countries?
Well, I'll leave that to Dr. Peekwell to answer, but you're assuming that the information that we see on the websites about certain countries is accurate. Some countries may have various reasons as to why they're displaying certain positive attributes with respect to their success rates and the like. But in any event, I think I'll yield to Dr. Peekwell, but obviously you
can
can't
just add
necessarily
to
read
that,
believe everything you read.
if you will. I think there are some statements there that I'm not certain I necessarily agree with. There, as the minister is saying, there are differences in the level of transparency between countries. And so we have to first ask ourselves, is the information that we're getting from every country as transparent as it is in Bermuda? We are giving information as it comes in. I can say also Bermuda is in situation of increasing our testing capacity, scaling it up very aggressively. And as a result, the more people you test, the more positives you will ultimately get. And I think that what we have seen as we've been doing surveillance and testing people who don't have symptoms, that the numbers of positives has not been exceptional, nor has the recovery rate been fared poorly compared to other countries. I think if you look at the numbers, we've had 140 cases. I believe something like 80 of those. I actually have the number, but the point is that we are looking at the number of people who've recovered from the illness, and as it turns out, I would say our recovery rate is quite impressive. It is adequate. It's around 67%. And if you're looking at recovery, you have to be aware of the time frame that you're looking at the recovery period for, so that we're considering recovered people who have for 14 days not had any symptoms, 14 days from when they were first diagnosed or when they were first symptomatic, and at least 3 days of no symptoms, I should say. And so recovery takes time, and a recovery rate currently of about 67% I don't find exceptional. But I do hesitate to make comparison between one country and another, because there is quite a bit of tragedy everywhere. And I think getting into comparisons is somewhat inappropriate in the setting of this crisis. But in Bermuda, I feel that we have, in fact, had a comparable recovery rate. So I wouldn't say that we are doing poorly. I would say that our situation is comparable to others, and we're doing quite a lot of testing, so we can expect to get quite a lot of cases over time.
All right. Thank you. My final question. We asked on Monday about why we don't have an ECMO machine in Bermuda. We referred to BHB, and they told us they do not have them. These machines provide critical care when ventilator support fails COVID-19 ICU patients. Why has Bermuda not invested in any ECMO machines?
For those who don't know, ECMO is an acronym for extracorporeal membrane oxygenator. And this is really just an apparatus that will bypass a poorly functioning heart and lung. And my understanding is that in a population this size, the number of individuals with critical care needs would not support the use of a machine or bringing one in for just Bermuda. There is an issue of proficiency as well, so that if you have an apparatus, if you have a procedure that's used on a small number of individuals, it is difficult to maintain proficiency. And I believe the hospital has made the decision that the need for such an apparatus at this point does not justify the risk of having it sit unused and people's proficiency lapsing. So I think more specifically why they have not aggressively sought to import one is a hospital question, and they might give more details than I can offer. But it is a risk to benefit assessment that has been done up until now, has not made it a high priority.
Thank
And
you
I
very
think
much.
It's important to note, as this was something that was discussed in a meeting earlier today with the hospital as well. The fact is that though we've unfortunately had persons who had passed away from this disease, none of those patients that have passed away would have been benefited from treatment from the ECMO.
Appreciate that. Thank you.
Good evening, everyone. My Placer here for Media Maya. My first question goes to Minister Keynes. You mentioned at the last press conference that there will be sobriety checkpoints starting up soon, and I'm wondering if that'll start tomorrow because of Bermuda Day, and whether
I did not say that there will be roadside sobriety checkpoints. The roadside sobriety checkpoints, that they have to be prescribed in law. And so when you have a roadside sobriety checkpoint, they have to be gazetted in the official gazette in advance of the actual night. That was not done in these circumstances. The Bermuda Police Service, however, will be on the roads and making sure that people are driving appropriately and that they are not driving with excess alcohol in their blood, whether they're on land or whether they're on sea.
Okay, thank you for that. My apologies. My next question came from a community member who just wants to know, what happens if you get a voluntary COVID-19 test and it comes out positive and you are asymptomatic? Do you have to be quarantined at the hotels, and what will happen to them?
That's a very good question. If you receive a COVID-19 test and it is positive, yes, you will be required to quarantine. But you'll recall we announced a few moments ago, and Minister Birch also confirmed that the quarantine facility, the mandatory quarantine facility, actually will be closing down. However, that person will now be able to quarantine at home, where they will have public health monitoring as well as regular checks from those persons that are enforcing, such as the police and the regiment.
Thank you. And my next question also came from a community member. I believe this goes to the Minister of Finance. They asked, can you please confirm the date when employers are required to stop deducting from employees?
We haven't. So for restaurants, it's immediately. Restaurants and bars, I think we announced that on Friday, because it's for the quarter that commenced on April the 1st. And that's the only folks who, at this point, we have granted that kind of relief to.
Okay, thank you very much. And my last question, we know that Cheval Dylan Burgess' case is now considered suspected murder, and that a 39-year-old man was brought into custody. Are there any new updates?
The Bermuda Police Service continued their investigation. As you said, that there was a 39-year-old man in custody. He has been released on police bail. The investigation is still ongoing. I think it's important for us to let the members of the Bermuda public know that they can still provide information at 295-0011 or 211 if they know any information about concerning the disappearance of Cheval.
Thank you very much. Those are my questions.
With regards to, we heard tonight that the quarantine facility is going to be closing and people will be quarantining at home. Can you tell us if we've got any more progress on the enforcement app, the quarantine enforcement app that was mentioned earlier?
Any more progress? The cabinet, I think, approved the contract last week. The work is proceeding to get the devices on island in order to make sure that they are ready for monitoring. I think that those things will be more apt to when we're talking about a broader level of when we have more persons that will be coming in, arriving at the airport. But I think that the cabinet subcommittee is confident that given the threat levels that we are able to sufficiently manage the risk with self-quarantine, and we can close down the government quarantine facility. I think that there will still be some level of government quarantine facility, which is necessary required for persons whom are unable to quarantine at home. So you may have an instance where you might have an infection. It might be a place where you are not able to quarantine at home, and we need to make sure that we offer those facilities as well. You should add anything to that, Colonel?
I would like to remind that we are going back to a position that we had prior to establishing the government quarantine facility. And Health have reported that during that time, very few people actually broke the rules. And once those that had broken the rules, in the main, they found them not staying at the home where they had indicated, but staying at Granny's. So they still were quarantined, just went to more comfortable accommodation. So we feel confident that people understand the risk and are going to adhere to the requirements. And the oversight and coverage of checking on them is sufficient for them to do so. And then certainly as soon as the vans arrive, then we will utilize that technology as well to assist us in monitoring.
Appreciate that. Thank you very much. We've heard tonight about the Health IQ app. Do we have any figures on how many people have so far been using that? And I wondered whether or not we can draw from that, I guess, the extent to which people might take up the opportunity to use a tracing app, which might come in the future.
Thank you for that question. I do not have the numbers, but I know at last check, I don't have the information. At last check, it was several thousand. I don't have the number with me, I'm afraid. Sorry.
No problem. Thank you, Amy.
If I may just add to the Minister of Health, luckily for me, I was tagged in a tweet from the Health IQ app yesterday, and they celebrated 5,000 submissions. So I think that was it. I managed to retweet it. But I want more persons to go ahead and make sure they go ahead and submit that information online, certainly. But I think that the number is exceeding 5,000, and we want more persons to download the app and to go to the website healthiq.bm to go ahead and submit their information. I've certainly gone on there to submit mine, updated the ones for my family. I'll encourage all Bermudians to do the same.
Thank you very much. We're seeing on some of the social media apps today that the Southside drive-through facility is out of antibody tests. Is that the case? And I guess when are we going to be getting more in? And are people being made aware of that before they turn up?
I don't know if people are being made aware of it before they turn up, but it is correct that the Southside facility is out of antibody tests. 1,500 were ordered. They were voluntary. Remember, they were not required. They're voluntary. And from Dr. Weldon's reports, most persons did elect to go ahead and have that particular test done on themselves. The government has ordered more. They will be arriving shortly, and then we will recommence that particular testing. But I think that it's important that we recognize, and as has been stated before, that the antibody test is not being done by its own. No individual was ever able to get an antibody test by themselves. It was done in conjunction with the real-time PCR test, which is the nasal pharyngeal swab, as that is the gold standard to ensure and to report a current infection. The antibody tests are better to know if there has been a antibody response in the body in the past, but we want to make sure, and our testing is to diagnose active infections, and that's the reason why persons can't get antibody tests by themselves. Surely, when the more antibody tests arrive, they will be deployed, and I'm certain that persons will be informed of that.
I appreciate that. Thank you very much. Minister of Finance, has there been any consideration given either to extending the 12-week maximum for the unemployment benefit scheme, or perhaps to putting something in place for maybe guest workers that will be unable to leave the island if and when that period comes to an end?
We still have about 4 weeks left on the program from its initial 12-week phase. We'll have to give consideration to whether or not we want to extend the program beyond the original end date in June.
Understood. Thank you. And is there any further update you can give us with regards to negotiations with union representatives, public sector workers?
We've received a response from the unions, and we are in the process of preparing a reply to their response.
I appreciate that. And with regards to the removal of the surnames for the retailers, can you tell me when that information was made available to the retailers? I believe there were some today that were turning away customers because they didn't realize that that restriction had been lifted.
Happy to share that. I know that I had emailed the information to the the CEO of the Chamber of Commerce last evening. It was something that was released in an unconventional fashion. We had wanted to get the regulations done last night and published last night. Unfortunately, they were not done and published until this morning. However, there are a number of various retail establishments that had contacted us. We knew that that change was made on and decided at Cabinet on Tuesday. We weren't able to get the regulations out on Wednesday, and I just wanted to make sure that members of the public could be made aware of it. So I did put it out on my social media. Most most stores were very happy. A large majority of those stores received shoppers, and I did receive an immediate response from members of the Chamber of Commerce and other retailers thanking the government for that decision. But it just shows that the government will listen to the decisions, and the committee, which is led by Colonel Birch, is going to take all those considerations in action under advisement and make the changes which are necessary, which are going to keep the country safe. So yes, the first place that people would have heard about it was on my Twitter account, but it was also simultaneously shared with members of the chamber and others. But there were persons who were aware of that before, because there's been a number, and if I look at all the questions which came online and others, there's been a number of retailers that asked for that particular change. It wasn't done initially as we wanted to make sure that it wouldn't create issues for retail. After we saw after the first week that it certainly created less issue, and now that has been removed.
Super. Thank you very much. Thank you all, and happy Bermuda Day to everybody when it comes.
Good evening. Minister of Finance, as we are aware that BEDC has offered
small packages, financial packages to small business owners. Is your office going to offer some type of assistance to restaurant owners on Front Street that rely on tourists and doesn't see that happening? And they are suffering and they're needing assistance. Is there any consideration for these owners, business owners?
Trevor, last week, Friday, in the House of Assembly, I believe I announced that we were offering relief to the restaurant and bar sectors in the form of payroll tax relief from both the employer and the employee for the quarter started April 1. I was also advised that we will take a look at this on a quarter-by-quarter basis. I think I've mentioned before that we are expecting a significant reduction in projected government revenue and a significant increase in unbudgeted expenditures. And so I have to be very wise in terms of the concessions or relief that I grant, and have to look at it on a case-by-case basis over periods of time.
So they would have to make an application to you to talk directly to you then?
Well, I wouldn't
If
say
they
an
want to go a little
an
further.
application. I would say that we maintain a regular dialogue with various stakeholder groups, including the Chamber of Commerce Restaurant Division. Teresa Chatfield sits on the Economic Advisory Committee. Those of you who know Teresa, she's not a very shrinking violet or shy type, and she is a very strong advocate for the restaurant and bar sector, and hospitality sector, more broadly speaking. So we will assess the situation as it develops and make the right decisions at the right time.
Thank you. My next question is also for you. With the quarantine facility shutting down, what has it cost the taxpayers of the government for these facilities, the hotel facilities at that?
I think the best person to answer that question would be the gentleman to my right.
I'll be sharing with the Premier and the Cabinet on this Tuesday an amalgamation of all the expenses. I would like to share it with my colleagues first before we discuss it publicly.
Thank you, sir. I'm not sure who can answer this, but I have some queries from laundromat owners that are really, they're saying between Monday and Wednesday, it's very slow at the laundromats. They would be, if the government can consider giving them from Wednesday to Sunday, where the bulk of their clients are weekends, can some consideration be offered for laundromat owners in this regard?
Let me add, here's what I'll say. Go on, Colonel.
As we did.
Laundromats until you just ushered it.
Sorry?
And we've not had a request from laundromats until you just uttered those words.
Okay.
And so if they make the proper outreach,
Mhm.
we'll certainly consider it.
Okay. I just gave the question. So can you we'll leave it like that.
I think, Trevor, the moral in that story is for your readers is that they're welcome to contact the government directly and to reach out on these particular topics. And they are welcome to email my email address at premier@gov.pm, receive a number of particular queries, whether it be from retailers or others, and those are appropriately routed to the various ministers, and they will go to the Minister of Public Works' Cabinet Committee to consider any particular changes. And he will coordinate with the Minister of National Security, Health, and others to see and make that recommendation. So I'd strongly encourage persons to go ahead and use the official avenues for communication with government.
Thank you, Premier. One more question for you, Premier. With the temperature warming up and the humidity getting higher, there are a great concern of Bermudians that are having issues with the masks and having trouble breathing. How long do you think this, how long will we be having to use these masks? And that's a question that was asked for me to ask you.
I may defer to the Chief Medical Officer.
Well, I'd have to speculate. It really is about understanding the transmission of the virus, and that is that as long as it is circulating and people are able to spread it person to person, we would need to do everything possible to reduce the chance of that happening. So that's what the masks do. Granted, it becomes a real comfort issue in the warmer weather. People will have to do their best to primarily maintain physical distance. I think that is probably the most effective way of making sure there isn't spread and avoiding crowds and small enclosed spaces, and certainly shielding those who are most vulnerable. But the masks, I believe, are here to stay for a while until the virus stops circulating, and I couldn't predict when that's going to be, but I certainly am as hopeful as everyone that it will be soon, so that the comfort issues can be dealt with. But at the moment, stopping the transmission is so much more important than personal comfort, that we are all having to sacrifice that little bit to protect each other.
Good stuff. One more question for you. As we see in other places around the world, we got a new wave of this virus. I'm going to try to paint a scenario. If the airport stays closed and we have more numbers going up, is there the possibility that this virus can mutate in those that have had the virus and take the numbers up?
That's certainly within the realm of possibility. I think we're all very well aware that viruses do mutate. I think that the crux of your question is, if we are an enclosed community and no one's coming in, and only we have the people who've had the virus or those who will shortly get it from those who have it, do we have to worry about there being the possibility of reinfection? And that is being researched as we speak. That is one of the big questions. What is the level of immunity that you get from having been infected with the virus or having been exposed to it? That is an area that's not clarified yet. It would be a concern, certainly. Typically, if you have an infection and you develop immunity against the pathogen, that immunity lasts a while, sometimes a lifetime, sometimes just many years. But in the case of coronavirus, it's just early days. We really don't know. So this is all speculation about what would happen if we are just an isolated island. What would happen to those who have been infected, whether they have the potential of being reinfected. Eventually, obviously, in a closed environment, either people will be infected and recover, and or not, and that at some point the virus stops circulating in an enclosed environment. But that is not a reality. That's never going to happen anywhere. So because it's a pandemic, there will always be the occasional reintroduction.
Thank you. Minister Keynes, this question goes out to, it's about work permit holders. Can the applicant or can work permit holders apply for permission to reside in Bermuda and seek employment, or do they have to leave? And a follow-up to that question, if they haven't been working, their contracts run out and they don't have the finances, do they have to leave, and how would they be able to leave?
Firstly, I want to put in context, because I do not want to set the stage for this to morph into where we are trying to get expatriates to leave our country and it turns into xenophobia. So I don't want us to give the misgiving with that sort of a question respectfully that we will be forcing anyone to leave Bermuda. We have the opportunity to look at each request on a case-by-case basis. I shared that this is an opportunity for us to be very prescriptive, for the board that is chaired by MP Renee Ming to look at the application, to look at the merits of the application, to consider the environment that we're living in, and to make decisions based on that. People have the opportunity to reside and seek employment. You heard from the Minister of Finance, and he shared that over $32 million has been paid in employment benefit. I have been informed that over 2,000 of the people receiving the unemployment benefit have been guest workers. If a person is out of work, they are unable to support themselves, the employment benefit is not a reservoir of money forever. We have to make some decisions, and some of the decisions that we have to make in the Department of National Security, especially the in the Department of Immigrations, are difficult decisions. When a person is looking to reside and seek employment, we have to look at the facts surrounding that. There might be an opportunity if a person the employment has been terminated in one part, but we have to look at all the circumstances surrounding that. One of the options is that the person might not be given the opportunity to get permission to reside and seek, and they would be asked to wind up their business affairs and leave the island when the airport opens and people are available. Again, we realize that we have a unique biosphere. There are a number of people in our country that are out of work. We want the opportunities for Bermudians to retool, retrain, but we also want them to be given opportunities to take on roles that become available because of the changing of the landscape with reference to employment.
Thank you. My last two questions. One,
Thank you very much, Director Wilson. And what I would like to say to all of Bermuda is that there's been a lot of information that has been shared today. I would like to extend my gratitude to the members who are here with me today, the members of Cabinet, the public officers, the Chief Medical Officer, all those persons who continue to support our work, the members of our caucus, the members of the legislature, and everyone who continues to work together to provide the advice to the Cabinet so that we can make the best decisions in the interests of this country. I want to remind everyone to have a safe holiday weekend. Please do not do anything that will end up getting you in trouble against the law. We are still under a state of emergency. We still have a virus that is circulating inside of our community, and it is not the time to act as though if all is normal. It is going to be difficult. I have faith and belief that we can keep our composure in order to keep the vulnerable persons inside of our community safe. So with that, I wish everyone a happy Bermuda Day weekend. Thank you and good evening.
Bermuda joined CITV on Friday, May 29th as the island celebrates